The Skincare Through the Ages series is sponsored by Neutrogena. To learn more about the products mentioned in the episodes, please visit the link in the description.
Hello, and welcome to the Science of Skin podcast, formerly known as Skincare Confidential. My name is Dr. Ted Lain. I am a board-certified dermatologist and your host for today. We are covering men's skincare as part of our Neutrogena takeover, Skincare Through the Ages. We're not really talking about a certain age today. We're talking about a gender, and that is the male gender. And we're going to talk about how skincare differs and the skincare recommendations differ for men versus women. I've got two incredible guests today. First, I've got Dr. Terrence Keaney, also a board-certified dermatologist. He is the founder of Skin DC. He's also a clinical associate professor at George Washington University, Department of Dermatology. Terrence, thank you so much for being here.
Ted, thank you so much for having me.
It's going to be great. Okay, Corey Hartman is the founder and medical director of Skin Wellness Dermatology, also a board-certified dermatologist. I forgot to say that. He's an adjunct associate professor at the UAB Heersink School of Medicine. He practices in Birmingham. Dr. Hartman, thank you so much for being here.
It's my pleasure.
Well, let's jump into it, gentlemen. Skincare for men. I mean, goodness, we spend so much time talking about, aesthetics for men, but let's talk about skincare. And in terms of your recommendations for men versus your female patients, like what are some foundational differences that dictate what products you would recommend for men versus women? I don't know, Corey, if you want to jump in here.
Sure. So the recommendations for men are always going to take into account the fact that most men are not really going to be able to adopt a very long regimen on a daily basis. So I always try to keep that in mind. And we try to pack as much punch as possible in a few key products. I like to tell patients about the Holy Trinity, which is like a moisturizer with skincare, maybe an antioxidant, and then a retinol at night. This really does accomplish most of the goals that most men are really interested in achieving for their skincare, and they complement their procedures very well as well.
Keeping it simple is certainly key for guys, right? We love those Swiss Army knife products that can do so many different things. Terrence, when you're starting to consider, skincare, you see a gentleman, you maybe do some neurotoxin, some filler, laser work, and now it's time to kind of support that investment with at-home skincare. What are you considering?
Yeah. I think Corey did a great job of highlighting how, the behavior of men is different, but the biology of the skin is different. And really the kind of the ultimate player of the biology it's just how important sex hormones are on skin function. So, men obviously have a lot more testosterone, and that can have some positive things. So men have higher amounts of collagen, the skin is thicker, but testosterone potentially also plays a role in how we respond to oxidative stress. So men have higher rates of oxidative stress, and that may play a role in why men in general respond more poorly to all cancers, including skin cancer. So skin cancer rates are higher in men. Men also have a higher rate of UV-induced immunosuppression. So these are some few biologic factors that I think about. So what does that mean in terms of skincare? Well, number one, I think Corey's right. Let's keep it simple. But a mainstay in my recommendations are antioxidants. I think antioxidants are key, and particularly in men, because once again, highlighting men have higher rates of oxidative stress, higher rates of skin cancer. So antioxidants are critical from an anti-aging perspective. Retinols are really important because men, can potentially also tolerate retinols more. Sometimes in my female patients, I may or may not be able to implement retinols. They have this, everyone's heard about retinols. Everyone wants to use retinoids, but men can often tolerate it a little bit more because of the increased sebum production due to testosterone. And then lastly, in terms of moisturizers that Corey mentioned, we have these kind of two classes now of moisturizers. You have the kind of traditional cream moisturizer, which are preventing evaporation of water. Those are your lipid and water-based kind of classic moisturizer we think about. I tend to skew farther away from that for men because men tend to be oilier in general, but keeping hydrated is important. And men actually have lower amounts of water in the skin, even though they have more collagen, even though they produce more sebum. So that this is where HA products, hydrators, I find are really home runs for our male patients.
You kind of teed me right up to talk about a Neutrogena product that really fits in with what you just discussed. I think the Neutrogena Hydra Boost Water Cream is a great product to consider for your male patients because it has that hyaluronic acid, but it also has the data to support 72 hours of hydration after application. So if we are considering men to want to use the least number of products but get the most benefit from each product, that's a good one to consider, especially for the oilier male patient who may not need as much moisturization. This is something where it could be applied every other, maybe even every third day, based on the data that we have. And as Dr. Keaney said, the hyaluronic acid really is such a great humectant to draw water in. There's multi-weight HA, right? There's the higher weight HA, which acts as a true moisturizer. It seals in the water, and then the lower weight HA, which brings in the water as a humectant. So thank you for that, Dr. Keaney. And then Corey, we also mentioned retinols, and Neutrogena has just such a long history of retinol development. A lot of people maybe discount these over-the-counter retinols and think they have to go to prescription strength. But we know there's tons of data to support the retinols that we can purchase at a great price point.
Absolutely. The over the counter retinoids really get the job done. And I counsel patients that if you aren't suffering from acne, where you really need a prescription retinoid to treat that skin condition, an over the counter retinol, especially the ones that we have today, they've come a long way. They give the efficacy, they help to stimulate collagen, they help, keep the pores from getting clogged and normalize the keratinization of the skin. They help to even out the skin tone, but they do it in a way that is tolerable for most patients. So another thing about men, I have a psychology degree for my undergraduate degree. So I always am thinking about the psychology of getting people to be consistent and to be compliant with regimen. And if you have a lot of irritation or intolerance to a product, I feel as though men are less willing to continue to use that product. So anytime you can get good results with as little irritation as possible, particularly for this population of patients, it's going to help to increase compliance, which of course increases the results.
Oh, I love that. And Dr. Keaney, you consider, I would imagine, I don't want to put words in your mouth, but you consider retinols as kind of a mainstay of any regimen, especially when you're going after rejuvenation and using, lasers in particular.
Absolutely. Yeah. So if patients are going to be investing in laser procedures and investing in treatments designed to slow the aging process, well, what are they doing in between those lasers to preserve those results? And so if they're already investing heavily in the lasers, it's a small investment in comparison to you adopt good skincare. So, and that's very easy for my male patients to kind of, convince them talking about their ROI, like what can we do to preserve these results to sometimes even delay the frequency of laser treatments, so if you take, adopt a really great skincare regimen, you may not have to do that resurfacing as frequently, so they can save money in the long run. I think sometimes that's some of the psychology I work with my male patients and kind of getting them to adopt a skincare regimen, because historically men aren't as accustomed and used to using skincare products, and so as they go older and they want to, but we also have to pick products and regimens that they will remember and they'll adopt and use consistently. So like Corey mentioned, finding products that don't irritate, finding products that tactilely feel great on traditionally somewhat oily skin, like a Hydro Boost. Those are all kind of strategies to get men to continue to use their products.
Yeah, and Neutrogena has a rapid wrinkle repair retinols, which again have so much data to support how well they work to induce so many changes in the epidermis and dermis. So that's a good one in my view to choose over the counter. And there's also been some data performed on skin explants, looking at if we use a moisturizer before or after a retinol, does that decrease the efficacy of the retinol? And Neutrogena produced this data, kudos to them, to show that what we call the half sandwich, whether it's the moisturizer first or after a retinol, doesn't really decrease or mitigate any of the efficacy of the retinol. However, if you used a full sandwich where you did moisturizers such as the Hydro Boost and then retinol and then the Hydro Boost again, that actually did mitigate retinol efficacy. So in some patients, we just need that, don't we, Corey? Like we just have to do the full sandwich because they need that support during the first retinization period. but boy,
Yeah,
it's important.
especially exactly those first few weeks where whether you're going to onboard it more slowly and have them applied every other night, I think that the moisturizer is always key. And I've been recommending that for years. So I'm glad that this paper corroborates my anecdotal findings. Yeah, but like Dr. Keaney said, the skincare regimen is an easier buy-in for men. I tell them it's like the insurance policy. They just bought a new car and you want to make sure that you're gonna get everything out of it that you're supposed to. And that's usually a pretty easy sell if you can keep the regimen simple and effective.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.
Talking about antioxidants, guys, because Terrence, you mentioned antioxidants as well. I totally agree, especially AM application of antioxidants are such a foundational ingredient, just like we mentioned moisturizers and retinol. What ingredients and antioxidants, just to give those people out there some idea of what they should really look for in their ingredients for antioxidants, what are you highlighting, Terrence?
Yeah, I mean, there's more and more antioxidants being developed. I mean, I think where a lot of the data comes from is the classic vitamin C, vitamin E, ferulic acid. Those are kind of
Uh-huh.
mainstay, kind of the OGs. There are also, newer products, bakuchiol. I always
Bakuchiol. Yeah,
bakuchiol. I always
I know it's a tough
butcher
name.
the name. Um, but you know, I often, when I'm looking at antioxidants, particularly for men, I'm looking at the science, but I'm
Mhm.
also looking at the formulation. Men are sometimes, clumsy. A lot of antioxidants are, or all of them are sensitive to sunlight. So they're, the way these products are packaged in often opaque bottles and often use dripper droppers. I find some men are a little resistant to that, and how I kind of incorporate men to use these products because they're often, like you mentioned, Ted, used in the morning, is to pair it with something that most men, except myself, who do every morning, is shaving. So I say, look, those old school aftershave, like alcohol based products that burn your skin, throw those out. Here's your antioxidant. Pretend this is your aftershave, and pair it. Put it right next to your shaving cream, and you're going to be using this antioxidant. And there are some gel formulations that are really nice. And so I tend to gel non-alcoholic, kind of like serum-based antioxidants that I think are nice for men, particularly post-shaving. And that shaving, actually shaving may enhance penetration of it because you're almost you are exfoliating, you're cutting the hair and mildly exfoliating the stratum corneum, so you're going to get enhanced penetration. So that's one kind of mental strategy I use, beyond going to their pocketbooks with kind of investing in the product, but also pairing it with a behavior they're doing every day to ensure compliance.
Oh, I love that. Dr. Hartman, do you use any other strategies?
That's my biggest one too, is to make it
Yeah.
part of something that they're doing every single day.
Yeah.
And then also just talking to the patient and really getting a sense of how they have interacted with products in the past, what were their turnoffs, try to use those clues to select something that you have a good chance of them being satisfied with and compliant with.
I do something a little bit unorthodox, but I have them. I find a SPF that my male patients like, because a lot of male patients just complain so much about using sunscreen all the time. Actually, Hydro Boost has a great SPF sunscreen in that line, and I'll have them put, a pea-sized or an English pea-sized amount of the sunscreen, and just add 2 or 3 drops of a antioxidant serum to that, mix it together, and apply all that together. I am sure I'm mitigating the effects of both the sunscreen and the antioxidant, but at least we're getting both on the skin, and I found that to be somewhat helpful. Makes me feel better, at least that I know they're using antioxidants and sunscreen in the morning, which we know are so important. As we move to nighttime, gentlemen, what kind of ingredients are you really focused on as we head into their nighttime routines? Terrence, if you want to get started with that.
Yeah, that's when I'm trying to incorporate the
Yeah.
retinoid products. And I often, we want to avoid irritation, so I often have them use it, every other night in the beginning, and pairing with with often a HA based product like the Hydro Boost. And I start with that. I try to keep it simple. Two max. Maybe if they can tolerate the retinol, they're kind of oily and they're like they don't really need a moisturizer. Then sometimes some of these guys can fly with the just the retinoid at night. Uh, I pair that behavior with brushing your teeth. So I say my joke is the antioxidants are next to your shaving cream and your retinoids next to your toothpaste
Uh-huh.
in your cabinet. That way you don't remember. Those kind of get paired together, and then you can incorporate the sunscreen in the morning and the moisturizer as needed. So uh, that's kind of the basics for all my patients. Now, we are often talking about how men are less likely to adopt complicated regimens. I do find the past 5 years, though, men are a little bit more, uh, uh, you know, uh, accepting of skincare, asking more questions, and I think social media has played a big role of that. Particularly younger
Yeah.
guys are trying to be more proactive, which is great, and our older men are needing a little bit more handholding. But I think that's why we're seeing the male skincare market kind of grow
D-
as it has.
what do you think about DNA repair? Is that something that you consider at night at all, or do you feel is the science there in your eyes, or do you not you're not ready to kind of recommend those products, Terrence?
DNA repair products,
Yeah,
you
DNA
know,
repair enzymes and products. Yeah,
yeah. I mean, and there's a there's the DNA repair, there's regenerative products, you
yeah,
can use the growth factor serums, you have topical exosomes. I mean, there's a whole kind of rabbit hole.
yeah.
And so, you know, I try to, retinoids are my start. And
Yeah.
then depending on the sophistication and the proactive nature of the male patient or any of my male patients, I sometimes graduate or they can't tolerate the retinoid.
Okay.
Or then you can get really sophisticated and you start alternating. I tend not to, I won't use those products at the same time. So if I'm incorporating a DNA repair or a regenerative or collagen stimulating product, then I have to back off on the retinoid, or you can
Uh,
alternate. But this is kind of more. This is where you're. This is kind of like the graduate school course of
yeah.
nighttime skincare, and it can get complicated. Where my female patients are like, give it to me, like this
Right.
this make it as complicated as possible. I do have male patients that do that, but I don't start them on that pathway.
Okay, so for you, okay, so hearing you loud and clear, then foundational antioxidant in the morning, moisturizer, retinol at night. That's the first step, and many patients will stay on that step and still do really well. But if they're willing to go a little bit kind of beyond that, we have lots of different options. Corey, do you agree with that approach?
Yeah, I think that nighttime belongs to the retinol. That's your
Okay.
skin's chance to rejuvenate itself, to kind of rest and, re-up for the next day. And the nighttime is a perfect time to do that. I pair it with the dental floss because you should be flossing your teeth every night, not just brushing them. And that encourages behaviors that, will hopefully help each other to be stronger. DNA repair enzymes. That's a good question. This is where I really start to get into products that do more than one thing. So, maybe I can find a sunscreen that has DNA repair products and get them to commit to that alone. Then we're talking about, like Terrence said, I want you to show me that you can be consistent with three things before we start adding, 4, 5, and 6. If there's a particular um, what am I trying to say? Need in your skin. If you have dark spots or if you have redness, people are going to be more motivated to treat something that they bring to your attention that they see as a problem. But as far as us adding things, and then some of these regenerative products, the science I don't think is there 100% to really buy in, to recommending that all the time. I'm a huge proponent of foundational consistency with products that have a proven track record, like retinols and hyaluronic acid.
It's funny, guys. We talk about how we kind of have to handhold our male patients through a skincare regimen and treat them very carefully and make sure we're choosing the right products. But man, when you have a guy that comes in that's losing hair, they're willing to throw the kitchen sink at the hair. It's like the female patient for their face, the guys for their hair. They're like, bring it at, give it to me. I'll take anything. And so it's just such a different mindset, of what guys are really focused on versus what women are focused on. Not to say women aren't focused on hair loss. Of course, that's a huge deal, but we get guys coming in earlier and earlier now, don't we? Talking about hair loss. I feel like the new paradigm and expectation is that men are not supposed to lose hair anymore. I don't know if you guys agree.
Yeah, I think that it's changing for sure. And a
Mm-hmm.
lot of it is the rise of social media and just the societal acceptance of men being allowed to even care about some of these things and some of these topics that they're more comfortable bringing into our office. hair loss for sure. But I think it's also because now we have some effective treatments.
Yeah.
Yeah.
Terrence, you
And
agree?
also, yeah, hair loss. I mean, so with women, the first signs of wrinkles or signs of photoaging is the first giveaway for aging. With men, the number one age accelerator. So there's done studies looking at guys with a ton of wrinkles and brown spots with a good head of hair, and a guy with no wrinkles, no brown spots, and balding. The balding guy looks older. So, for men in particular, a receding hairline is the number one age accelerator to other age older age appearance to others. So that really gets their attention at a young age. And if it happens at a young age or any age, especially if they start looking different than their contemporaries, so they're losing hair compared to their peers, that makes them look older and feel older. So they're going to be very proactive. Whereas a wrinkle here and there, is not the end of the world for a guy. You can see some of these recent male celebrities have been critiqued getting facelifts and getting rid of all their signs of periocular aging, and people are criticizing them because they almost look weird because there's no any evidence of aging. Whereas, a female celebrity in the 60s gets a great facelift and everyone's celebrating and trying to find out a plastic surgeon. So, there is this, a little signs of aging in the male face is not necessarily the end of the
Actually
world.
considered attractive.
Yeah, but a nice head of hair is considered very attractive. So you can
Right.
see why there's sometimes a overemphasis on hair versus skin in a lot of our male patients.
It made me realize as you gentlemen were talking about this, like guys can't, they, early on in life, they don't want to lose any hair because that's a sign of aging. And later on in life, they don't want to lose their virility and their exercise tolerance and their energy because that's a sign to themselves that they're aging. And so they get on testosterone, for example. Well, we know what testosterone can do to the skin, and that kind of changes our paradigm of skincare. As the older men in particular get on testosterone, things totally change, Corey, right?
Oh, 100%. Yeah. I mean, testosterone, I've seen it wreak havoc on acne. I've seen it cause, additional hair growth in places that they don't necessarily want it. So there's a push and a pull with everything. And testosterone is included in that number.
Yeah.
Yeah.
And the dose matters. I mean, I think testosterone could be just like anything, could be managed appropriately, but I think a lot of, testosterone is one of those weird things where people go online and get mega doses, and that's where you
Yeah.
see the problem. And guys, you know, being muscular is kind of addictive, and all of a sudden they're in their 40s and 50s and they want more muscle and they keep up in the dose, and that's where you run into problems. So it's kind of super therapeutic, super kind of physiologic doses of testosterone.
Yeah, I mean, we start getting some major issues with cystic acne. We start getting issues with sebum production, and that causing closed comedones on the face or blackheads on the face, and then we start to really have to up our retinol game to kind of keep up with all these different changes that are happening. In addition to that, we have seasonal changes that we expect throughout the year, where summer is a little bit more oily and easier to hydrate versus winter, where everything gets drier and you have to maybe change your retinol routine and your moisturizer routine as well. So there's a lot to deal with guys, just like with women, as they get near and enter menopause, skin changes dramatically. Men tend to do that just exogenously with testosterone, and we have to deal with that. So don't think that you can see your male patient one time, recommend a great foundational skincare regimen, and that's it. You'll need to see them back to tweak it, because their life is going to change, and you never know what supplements and medications they're on that can change their hormones. So, gentlemen, this has been great. I just want to kind of just round out the discussion. And Corey, I know you're the psychology major, and I think we would all benefit from your knowledge. I probably should have done that too when I was an undergrad. Um, but kind of talking to a male patient who maybe, as we needs skincare, but can be very hesitant because of, societal pressure or the way they grew up and how their, father figure acted and dealt with their own skin. How do you just talk us through how you talk to somebody like that? As you said, you kind of have to start with the basics, but how do you say, it's time for you to start really taking care of your skin?
Well, most of these patients are in your office for one reason or another.
Mm-hmm.
So you have a captive audience, and it's all about tying it to what brought them in. And if that concern isn't necessarily brought them in. Maybe they're in the office for skin cancer or pre-cancers. And, you can use that as an opportunity to talk about how they can improve their overall skin health so that they can decrease the risk of these skin cancers. A lot of times they'll come with their wives and they're kind of in the back and they're a little bit shy about it, and we can break that down. Again, I tell them, I meet them where they are. I'm not going to give them more than they are capable of handling. And even with this very basic 3-step regimen, the Holy Trinity, I call it, sometimes we will start with one thing at a time, because 3 products can be overwhelming to somebody who's never thought about this before. And that can also put them in the position of thinking that maybe it's not really right for them. I'm glad that a lot of the companies are now designing their products in packaging that is a little more gender neutral, so that that's not an additional societal pressure on the patient to not want this particular product on their shelf just because of the way that it looks. So we've gotten some help from different aspects of the industry, social media, the marketing companies. They're actually going after men now and trying to meet them where they are. So it's all about the trust in the patient and the relationship that you have and just allowing them to open up. But again, always go really slowly and try to get those clues from them so you can meet them where they are.
Mm-hmm. Dr. Keaney, any other pearls of wisdom here?
Yeah, I mean, I try to get a gauge with any of my male patients what their main concern is. I think Corey mentioned that. Is it, skin health, like skin cancer? Is it more of a medical, like, what can we do to keep my skin healthy moving forward? And then I will kind of go down the science. I tend to be very scientific and nerdy. And I think sometimes men appreciate that rather than be like, this is great, this is going to make your skin look amazing. I'm like, look, you're at high risk of skin cancer. Men don't respond to skin cancer, to UV light as well. So we need to do antioxidant sunscreen. And maybe I'll start there, like Corey, if the guy's never used anything. So that's 2. And if I have more aesthetically inclined gentleman who's like coming in for, hair loss, and he wants to talk about lasers and whatnot, then I'll kind of give him the the 3-step program, the retinol, the moisturizer, the antioxidant, and often a sunscreen, and start there. And then as I develop that relationship and see how they're adapting to that skincare regimen, then I can kind of increase the complexity of the products and see how you go. And you'd be surprised. Some guys who are like never used anything, they love it, and they want to, all right, what's next? I want to add. And some guys are very aesthetically inclined. They're doing a million procedures, but they're like, no, I can only do 1 or 2 products max.
Yeah.
And you have to adapt.
Corey, I appreciated the comment of the fact that packaging now has become more gender neutral with these products versus companies really focusing on men and trying to make products just for men. Because I find those products just have so much fragrance in them to make them kind of musky or woodsy in their fragrance. And they men tend to like lighter products, as Dr. Keaney was talking about. They like the lotions versus the creams. And I just never had a lot of success with the male focused products. And so I really appreciate, and I hadn't really thought about it before you said it, that we really are moving towards more gender neutralization of the products that are great for both genders. You may just need to tweak them based on the gender, but otherwise they're the same products. You may just need to use them in a different way. So thanks for that. Guys, I learned a ton from this. Thank you so much. I got great pearls and great tips from both of you. So I know you're both aesthetic experts working in different areas of the country, and I so appreciate you coming on to the Science of Skin podcast. Again, my name is Dr. Ted Lain. This is a podcast where we really try and stay at the cutting edge and try and give real life pearls and tips that you can use in your own practice. If you appreciate this podcast, please subscribe. Please give us a 5-star rating and tell your friends. That's how people learn about us, by peers telling peers. And this, we hope you enjoyed this podcast to learn a lot. Dr. Hartman, Dr. Keaney, again, you're wonderful dermatologists, great colleagues, and I so appreciate you coming on.
Thank you.
Thank you so much.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.